right, we're talking about hurricane season and getting prepared for it. We took care of your home already. Now let's focus on your family. Is your family prepared for hurricane season, especially when it comes to medical concerns? Here now to address that topic from the Lakeview Medical Center is Dr. Douglas Gregory. Dr. Gregory, thanks so much for being with us.
Oh, great. I'm glad to be here.
Well, we are happy to have you because this is really something that a lot of people need to think about, and you need to think about before a storm is here. You need to prepare your family, especially when it comes to medical concerns like medications. If you're taking some medications, you need to be prepared in case you can't get to a pharmacy to get
Well, that's right, because we never know what's going to happen with healthcare services when we have a hurricane. Pharmacies open, hospitals open, so good recommendation is to have at least 2 weeks of any medications that you're taking, whether they're prescription medications or over-the-counter medications. So it's good to have those ahead of time. You want to make sure that you keep your medications dry. You want to keep them cool if they need to be. If it's powdered medication you're using, you want to make sure you have some type of purified or bottled water because you don't know about contamination of the water supply. So now if you have to mix medication, you have to have pure water. And a little hint too about insulin. We have a lot of diabetes now in the communities, and insulin needs to really be refrigerated. So normal refrigeration somewhere in the 30s to 60s in your refrigerator. But what happens if you lose electricity and you're a diabetic? If you can keep that insulin at least cool, less than 86 degrees in the environment, you can use it for up to a month. It's still safe to use. Now, of course, when you get a new insulin supply that's been refrigerated, you want to get rid of the old stuff and go back to the new that's been refrigerated. So that is an option.
So do your best to keep that cool of all your medication. Make sure you keep it cool. What about like medical records and things like that? I mean, most of them are like you can get on, and check your medical records, but the computers might be down.
Oh, yeah. I mean, everybody now knows about electronic medical records and maybe has a copy on a CD or a flash drive or something. And if you leave town and go somewhere on vacation, it's great to have with you. But as you said, what happens when the electricity's out and the computers don't work? So if you go to the Center for Disease Control, to their website, cdc.gov. They have a whole list of information there about disasters, hurricanes, particularly medical preparedness. And one item they have on there is called Keep It With You. Keep It With You. It's a form you can easily download, and you can fill in with all your pertinent medical information. You can then fold it, seal it, keep it dry, and there you go, you've got it.
Which is important. I mean, when you go, especially if if you have to go see a medical doctor and maybe their records are down, they can't pull up your records or your parents' records or whatever. They've got it right there. And
exactly.
That is a lifesaver.
So it's good to have the CD or the flash drive, but still good old pencil and paper works. And along with that, you want to make sure that you have your healthcare provider's information, phone number, way to contact them if you're out of town or in an emergency room. And it's important to have either your medical card and your pharmacy card or copies of those, as your family with you, because you'll need those.
You definitely will need those, and do it now. Before the storm, so that you can be prepared. That's one of the things I know you guys talk about. Planning ahead, being prepared, and patience, assurance, and love.
That's right.
I think is your...
Well, any time in a disaster, everybody gets a little upset and nervous about things. And I think that's always a good concept to keep in mind when you're working with your family, the elderly, your neighbors, is patience, assurance, and love. It'll get us through a lot of these dire straits and complications. Yeah,
because it can get pretty tense in the middle of a storm, that's for sure. What about people who have, family members that have some special health care needs that they need to, be concerned about?
Yeah, we forget about that sometimes. We may have elderly relatives or parents in the area are living with us, people with chronic medical conditions, diabetes, heart disease, asthma, other respiratory problems, and children with special needs. So certain things to think about. Are they on oxygen? Make sure you have adequate oxygen tanks available to take with you or have in your home. If they have some type of a motorized wheelchair, that they have extra battery or power, because again, who knows when power is going to go out. If they have canes or walkers, that they're available. If there are really special medications that some people have to take, again, that you have those available. And we forget sometimes about simple things. What about hearing aid batteries? If you have someone who's hearing impaired, we forget about those. And it's important to check ahead and decide if you have someone who has special care needs, do you need to evacuate them early? Do you need to move them inland to a relative or someone else who can care for them if there's an impending hurricane. Check with if you have someone in an assisted living community or in a skilled nursing facility. What are their plans? How do they evacuate? Are you responsible for their care? You know, what do you do in those situations? And let's not forget the service dogs. Some people have service dogs. You've got to make sure you've got, you know, food and water for the animal that's going to help.
Sounds like planning ahead and being prepared is really the key here. What about, you spoke about children, what about them? I know for like babies, you need all sorts of things for babies, but what about immunizations, things like that? You need to think about that as well?
Yeah, we as adults sometimes forget about our immunizations. I won't embarrass you and ask you when your last tetanus shot was.
I actually have had my Tdap,
well,
so I'm good.
Your Tdap, and that's important. But we forget about those things because as we get adults. And the big thing is tetanus. And as you mentioned, if you've not had the new Tdap, which is the tetanus with the whooping cough or pertussis booster, that should be the first thing you get because of the amount of whooping cough we're now seeing. So kind of a rule of thumb, if you haven't had one, a Tdap or a tetanus in 10 years, get one. Get one now.
If you can't remember, check with your doctor.
Check with your physician and get one. And if it's been more than five years and there's a possibility of a deep wound or penetrating wound, then you should get one. But if you've had the Tdap, at least get the tetanus. Don't forget hepatitis B if you've not had that. And most people in this area probably have not had the hepatitis A vaccine. It's 2 shots, 6 months apart. And that's important because remember, hepatitis A is spread through contamination of water and foods from human sewage. And who knows what's going to happen with our sewer facilities and our water supplies with a hurricane.
All right, Dr. Gregory, some great tips. Hopefully people will be taking notes and will make plans and be prepared with their family and get all
Be prepared, plan ahead, and PAL, patience, assurance, and love.
Some good advice. All right, thanks, Dr. Gregory. Stay with us. We've got much more to come.